Now away from this, in Enugu State, the State Primary Healthcare Development Agency and State Ministry of Health in collaboration with various agencies officially flagged off the Rubella Vaccination Campaign yesterday, aimed at protecting children and preventing the spread of the viral disease across the state. This vaccination campaign is critical to protecting children and preventing congenital rubella syndrome. The ceremony, which took place at Ọkpara Square, Enugu, marked a major step in strengthening routine immunization and safeguarding public health. Our correspondent, Chidima Mado, has this story. Take a look.
Rubella, also known as German measles, is a contagious viral infection that can cause serious birth defects if contracted by pregnant women. Health experts say vaccination remains the most effective way to prevent the disease. The campaign against rubella targets children within the age of 9 months to 14 years, and it is carried out across all 17 local government areas of the state. Health officials say vaccination teams have been deployed to primary health care centers, schools, churches, and other designated posts to ensure wide coverage. Flagging of the campaign, the secretary to the state government, Professor Chidebere Onya, while representing the governor, established the fact that science has given man the opportunity to fight against infectious diseases and hence the need to apprehend e-spread through vaccination. Therefore, he urged local government chairmen to ensure that children within their council area are vaccinated.
Science has given us a solution: one shot, double protection. Since our health workers hit the streets on the 4th of February, going from house to house, church to church, and school to school, we have achieved something unprecedented in the history of Enugu State. In just 7 days, we have vaccinated over 1.5 million children. We have hit 68% of our target. So I'm confident that with the type of workforce we have, the motivation of the team members, that we are going to exceed the targets that we set earlier. But most importantly, we have recorded 0 serious adverse effect. The vaccine is safe, the vaccine is effective, and the people of Enugu have embraced it.
The State Commissioner for Health emphasized the government's commitment to improving child health and reducing preventable diseases, as the director for the State Primary Health Care Development Agency declared that every child's health in the state is non-negotiable, as health remains a sacred vision of the state government.
Your Excellency, when you insisted that in the 260 Type 2 primary care centers that they must have solar energy, green energy, people thought it was just to provide light and to make work easy for us. But basically, it also ensures that these vaccines are kept at the right temperature. And all our primary healthcare centers, our coaching systems are getting this vaccine, and we're able to preserve it and keep it the way it should be, giving it at the right temperature, and that's why it's so effective.
Rubella is even more cunning. It incubates for 14 to 21 days. In a child, it might look mild, but if it touches a pregnant woman, it attacks the unborn child with what we call the Congenital Rubella Syndrome. It breaks hearts by causing heart defects, cataracts, and lifelong disability, even before the child takes its first breath. Our children cannot fight this battle alone. They need a shield. They need herd immunity. The good news is that we have the weapon to win. Science has gifted us a miracle, and it's called one shot, double protection.
Development partners, including representatives from World Health Organizations, also pledged their continued support to strengthen immunization services in the state. Health officials called on traditional rulers, religious leaders, and the media to support sensitization efforts to ensure maximum participation throughout the exercise. The Rubella Vaccination Campaign is expected to run for the scheduled period, while monitoring teams deployed to track progress and ensure success. In Enugu, Chidima Mado for Afia TV.
Thank you, Chidima, for that story. And of course, if you've not been vaccinated, go ahead and do that to prevent untimely diseases and, of course, infections. We're going to a quick news break now. When the show returns, we're taking quick stories from Imo and what Professor Chukwumachao Soludo said after his visit to President Bola Tinubu yesterday. Do stay tuned.